Hi, I'm Jennifer Dean with the EVP Institute. Let's talk about healthcare in the United States for just a second. There are anywhere between 250,000 and 400,000 unintended deaths annually related to medical errors. It's actually the third leading cause of death in this country. That's like 11 747s crashing every week. Quite alarming. What's even more alarming is the US spends twice as much of our gross domestic product on healthcare as compared to other high-income countries, yet we have poorer outcomes. So while our healthcare system in this country is very complex and pinpointing an exact cause is difficult, there are things that can be done. One of those things being to reduce variation, and that's where evidence-based practice comes in. Evidence-based practice, what is it? It's a problem-solving approach with three components: clinician expertise, patient preferences and values, and the best evidence. Evidence-based practice is the way that I like to think about practice improvement. Falls under the umbrella of evidence-based decision-making because not all changes are necessarily practice changes. So you could look at how to best build a house, how to best build a car, evidence-based dog training, all of those different things, right? Which aren't necessarily practice changes. So let's get an idea of roughly currently how many decisions or what percentage of decisions in healthcare are based on evidence. So the Institute of Medicine had a roundtable years ago, and their goal at the time was that by 2020, currently 2025, by 2020, 90% of decisions would be based on evidence, okay? So where do you think we're at? So that means 3 out of 10 things are based on evidence, and 7 are based on your guess is as good as mine. The way we've always done it, what I felt like implementing when I arrived at work today, or what I want to do. There is literature out there that when compared to traditional practice, patient outcomes improve by as much as 30%. There was also a scoping review that was done a couple years ago that showed that when a return on investment or an ROI was measured, it was positive 94% of the time when it came to evidence-based practice. So if you're interested in learning more about becoming what I like to call an evidence-based human, please contact me at the Evidence-Based Practice Institute, because after all, better outcomes are not accidental, and just say no to because we've always done it that way.